Can everybody hear me okay? Yeah, we're good? Okay. So thank you for joining us today. My name is Diane Ludwig. I serve as Centra's Public Information Officer. We understand new guidelines and criteria are released daily, and Centra's plans are changing rapidly. We want to thank our communities for their support and patience as we continue to implement changes. It is our sincere hope that these changes will ultimately make this community stronger in preventing this virus from spreading to our most vulnerable friends and neighbors. Today you will hear from our President and CEO, Dr. Andy Mueller, and our Chief Medical Officer, Dr. Chris Thompson. Also with us in the room today is Rick Grooms, our Chief People Officer, Dr. Les Reed, the President of the Centra Medical Group, Shelley Harris, our Chief Nursing Officer, and Carrie Watson, our Chief Operations Officer. With that, I will hand this over to Dr. Andy Mueller.
Thank you, Diane, and thank you all for being here today. You know, we really appreciate you being here to hear some of the things that we are doing to ensure that our community, our patients, and our caregivers remain safe as we all think about coronavirus and COVID-19. As Diane mentioned, you know, the situation is changing rapidly, so we wanted to alert all of you and the community about things that we're doing, again, to keep everybody safe. So effective today at 5 p.m., we're going to be prohibiting visitor access to all 4 of our hospitals: Lynchburg General, Virginia Baptist, Southside Community, and Bedford Memorial Hospital, as well as our Gretna Emergency Department. This is being done out of an abundance of caution for our patients to ensure that visitors are not going to be bringing any type of contagious material into the facility, and also making sure that our visitors remain safe. So there are going to be a few very narrow exceptions to the visitor policy, and those will be things like for obstetrical patients, they'll have the opportunity to have 1 visitor. Pediatric patients can also have 1 visitor, and of course that needs to be a parent or legal guardian. And then other exceptions will be considered on a case-by-case basis. There will also be exceptions made for patients receiving end-of-life care. And these new, more restrictive visitor policies for our hospital are already consistent with what we're doing at our post-acute skilled nursing facilities. And we understand this is going to represent some significant hardship for both patients as well as visitors. And we recognize the importance of social contact and visitation in the healing process of our patients. But we feel at this point that this is really the most proactive way to try to remain safe for all of those involved. And during this period, we plan to use other technologies to try to continue to keep our patients connected with their loved ones. So things like Skype, FaceTime, telephones, to ensure that there's some connectivity with those folks. We're also going to continue to have limited numbers of access points to our hospitals. So at Lynchburg General, we're going to have 3 access points that include the emergency department, the East Tower main lobby entrance, and the terrace entrance on Thompson Drive. In addition to that, Central Virginia Baptist Hospital will have an opening at Oak Lane entrance, as well as the Barker Cowling side entrance during regular business hours. Centra Bedford Memorial Hospital will have entrances through the emergency department as well as the main entrance. And Centra Southside Community Hospital will also have 3 open doors. Those will be the emergency department, the main entrance, and then the urology, oncology, and neurology patients will be able to enter through the 1927 building entrance. In addition to those changes reflecting our visitors, we're also going to be immediately canceling non-essential surgeries and procedures. This is consistent with a number of other healthcare systems and also consistent with the guidance given by the U.S. Surgeon General over the weekend. The discretion around what is essential and non-essential will be made by the service line leaders and physicians and surgeons who will be performing those procedures. If they're considered non-essentials, then we're going to try to postpone those cases and reschedule them at a later date. And we recognize that for our patients, that means we're going to be creating a backlog of these procedures that we're going to need to work through. And we're working hard to think through what a plan will look like to ensure that that transition occurs smoothly. In addition to those measures that we've discussed, we've also got some other changes that we're making both to protect our patients as well as our caregivers. And so one of those is that Centra is going to be restricting routine and elective follow-up visits for patients over 70 years in our clinics. Patients will begin getting contacted about this tomorrow and will be given the opportunity to reschedule those visits to a later date. And then if they have other needs that can be managed over the phone or through virtual visits, we'll be utilizing those services as well to ensure that no patients are going without needed medical care, as well as making sure that they still have access to prescription medications and other things that they may need. One of the other things we're going to be doing as of this evening will be closing the Dawson Inn temporarily. This won't be permanently, but right now with the restricted visitor policies, it makes sense that we go ahead and close that space as well. And then, heaven forbid, this becomes something much more significant. We have the opportunity to repurpose that space to care for patients if we need to. In addition to that, as we think about our own caregivers, all the employees who work at Centra, we're trying to do some other things to make sure that we're keeping them safe and reducing the transmission of the coronavirus. And that includes doing things like eliminating self-service items in our cafeteria and moving toward boxed lunches and bottled drinks as opposed to the soda fountain, as well as continuing some of the changes that we had implemented already last week, limiting meeting size to 40 or less and eliminating business travel. As well, we're also identifying those individuals who can safely work from home and still accomplish what we need to in terms of caring for our patients. And lastly, to try to help our community out and to help give answers to those who have questions about coronavirus and COVID-19, we created a hotline for patients to use. And we asked that this really be used for folks who have questions about symptoms or where to get treatment or how to get tested or those types of things. And of course, we won't be able to reveal information about patients or other things about COVID-19 specifically through that line. But that number is going to be 434-200-1225. So with that, I'm going to turn it over to our Chief Medical Officer, Dr. Chris Thompson.
Hi, thanks, Andy. I'm Chris Thompson. I'm the Chief Medical Officer for Centra. I know that everyone has probably seen the concept of flattening the curve. So what can we do now, and what action can we take now to ultimately flatten the curve and allow us to get by over the next couple weeks, next couple months, and stay below what utilization we can safely take care of. Make sure that our resources are able to extend to individuals so that a month down the road, we can look back and think of some of these decisions that may seem drastic right now, but be proud of those because it allowed us to preserve our people resources, our facility resources, and all of the other materials that we're using, including masks and personal protective equipment. It's at this time that it's really reflective to say we're in an area that actually has some natural benefits. We're in an area that does not have significant urban population problems. We're in a rural area where we are already socially distanced to a certain extent. And for those that think that that's not the greatest thing, right now it's time to cherish that. We're also grateful that some of the things that are being done, some of the hand washing, some of the activities that are being stressed also allow us to effectively take care of other things that are out in the community and would have been anyway, including flu and other viruses that are very serious. So I really want to stress that these isolation procedures that are being activated are helpful in many more ways other than just COVID-19. I want to stress the common sense precautions that we should continue. Washing our hands for a duration that is effective. And I don't know what everyone uses. I use singing happy birthday, not a fast version, kind of an average speed version that is a good duration to wash your hands, not faster than that. Don't touch your face. Liberally sanitize countertops and doorknobs and frequently touched objects with typical sanitizing agents. Don't need anything special. Lysol is just fine. And keep distance. When you're around someone that you don't know where they've been and you don't know if they may have been contacted or whether they may have a risk factor, 6 feet is a good rule of thumb whenever possible. So 6 feet is a tall person that you may know. Think of laying them down and staying that far away from that individual. In Virginia, we have 51 confirmed cases. At last check, there were 489 people tested. We're doing more than state testing, and there's now private industry has gotten into testing, so those numbers will be difficult to track from now on because LabCorp and Quest and now Roche and other companies are getting into the business of providing testing kits, which is good news. We have no cases positive in our Centra footprint, aside from the one that people are probably aware of in Prince Edward County out in the Farmville region. We do have patients that are in the hospital that have been tested. We've had negative results come back, and we're also waiting on results, but I want to repeat, have no other positive tests in the Centra footprint, which is a large 9,000 square mile footprint in the region. Virginia is not a confirmed community spread state, so we are listed as an unconfirmed community spread, meaning that has not been confirmed. Some may have just heard about there's a Charlottesville case, which is obviously just over an hour away. That is also a travel-related case, and that was just a case that was confirmed positive today. I want to stress the hotline that Andy mentioned, 200-1225. I think that in talking to people in the community, people do want to understand what they need to do to stay home and would like to stay home. And that strategy of keeping people away, out of the hospital, at home if possible and if your symptoms allow, is a sound strategy moving forward. So hopefully that line will allow people that want to stay home to have the information to be able to do so safely. Centra has developed drive-through testing sites that have been very effective, and at the current time, we have drive-through testing sites at Forest Urgent Care in Forest and at Southside in the community, in the ambulatory office there. We have 2 sites that are set to go live if needed and if demand indicates, and that's in Gretna and in Bedford. We also have tents outside of our emergency department, and I know that those have created a lot of questions in terms of how are those being used. Those are being used, again, to try to keep people that could be communicable away from going inside our facilities if at all possible. So if someone comes up, is very low risk, looks like there's someone that is going to be able to, regardless of a test result, be able to be treated at home, we're ultimately using those tents to ultimately get them rapid treatment and ultimately keep them outside of the facility and keep them in open air. We have tents outside of the Lynchburg General Hospital Emergency Department, outside of the Southside Community Hospital Emergency Department, and we're ready to put up as needed in Bedford and in Gretna as well. Lastly, outpatient testing. There's lots of questions, and it certainly is a moving target as we get more information regarding testing. Who qualifies for testing? I mentioned that we are not a community spread state. At the same time, we're conferring daily with our infectious disease specialists as they give us recommendations, and we implement their recommendations for testing. At the current time, keep in mind, influenza is still the predominant illness in the community. There is a lot of influenza out there, and again, we've not had a positive test for COVID-19 aside from the one we mentioned in Prince Edward County. Currently, for our outpatient testing sites, people who meet criteria for testing include those who meet influenza criteria. And remember that those symptoms include fever, 100.4 degrees Fahrenheit or greater, which is 38 degrees Celsius, runny nose, headache, muscle aches, flu symptoms. Along with that, patients that have comorbid illnesses, diabetes mellitus, congestive heart failure, chronic obstructive pulmonary disease, age greater than 50, and immunocompromise are in that list of criteria. At current time, the travel or contact criteria to be tested is being lessened, and so that is being lightened. And so we may find that there are specific cases with those criteria, flu-like symptoms and other illnesses that might warrant testing without a known positive contact or significant travel history. Lastly, how do you tell flu from COVID-19? And certainly the symptoms overlap significantly. What we're finding in a consistent way, and this is after consultation both with our physicians, seeing them frequently, and with our infectious disease physicians, is COVID-19 seems to have more shortness of breath, much more than flu, and a little bit of a lesser headache and lesser muscle aches than the flu does. And those are some distinguishing factors, clearly not diagnostic in themselves, but suggestive of those who may or may not be positive for COVID-19. I want to stress that whether or not you have a positive test, that the test does not dictate whether you can be treated at home or need some other form of treatment, whether it be inpatient care. Those are simply determined on traditional factors of do you need to have support that we can provide in the hospital versus being at home. If at all possible, the best outcome is for us to be able to treat patients at home and monitor them for the duration of again, 14 days or depending on if someone is symptomatic, until they're improving. Thank you.
Thank you. That concludes our official remarks. We will, at this point, take any questions you all have.
Does Centra have an infectious disease specialist as some other health providing agencies doesn't?
Yeah, sure. Thank you. We have several infectious disease specialists. So these are fellowship-trained physicians who all they do all day long is treat our infectious disease patients. And certainly this has been a big topic for them recently. But yes, but it's not only they who are helping us along and helping change our criteria, understand treatment that's up to date. The collaboration that's occurring between the health departments in our area, the infectious disease specialists, and really all the other physicians that are involved in care has been just tremendous. And so, yes, we're getting a lot of support and up-to-date guidance from them.
Are you able to say how many tests Centra has conducted already for COVID-19?
It has been, I can't. It's, from an inpatient basis, it's less than 10. On an outpatient basis, I'd have to get up-to-date numbers. And again, these are patients going through our drive-in sites and our outpatient sites. So less than 10 in the hospital setting and quite a few more in the outpatient setting.
How many tests do you have for people who might want to get tested?
Yeah, don't know the answer to that update. We have enough to let that not be the limiting factor for testing. What we don't want to do is treat a lot of individuals that don't really even come close to meeting criteria. So we want to make sure that we're taking the advice of our infectious disease physicians. The availability of tests is not a limiting factor at this point. In fact, in addition to DCLS, which is the state lab, LabCorp is clearly in the market of providing tests, and that's our primary provider right now. But in addition, Roche has gotten into the business, and other companies have gotten into the business of providing tests as well. So tests are becoming widely available and will become even more so over the coming days and weeks.
And I know that it takes, we can get the presumptive results back fairly quickly, but then it has to go through the CDC. Is it worrisome for you that it takes sometimes many days to get back a result, and those people might go out into the community and potentially infect more people?
Sure. Good question. It's a two-part question. One is how long it takes to get a test result. When we first started testing, and I think most recall this, the CDC was the only testing site. And for us, if we were to test here in this room today, we would have to drive a test result to Richmond, and it would then fly to Atlanta and the CDC. That obviously took several days. Since that time, the DCLS, our state lab, has begun to do tests. And in addition, with LabCorp, the time to get a test result has decreased significantly. So we are saying about 3 days. That being said, because testing is more available, there's a lot more tests being done, and we're getting test results in the 3 to 5 day range. The test result, however, does not dictate if the patient's out in the community. So if someone meets criteria to be tested and they're able to go home, that is a person that will likely be isolated in place and quarantined for that 14 days to take temperatures twice a day, to be followed both by the health department or their own healthcare provider. So again, the test result is not dictating exactly what happens with the patients. It's more symptoms, just again, knowing that there's going to be a period of time that we don't have a result.
So you'll be checking up on them, making sure that they are following that 14-day protocol?
Yeah, absolutely. Don't get me wrong. It's not a house arrest. So there's a significant responsibility for individuals to stay, to take a recommended quarantine. To date, we've not had anyone that's disagreed with that or wanted to, get out of their house. Everyone has complied for both their own safety and the safety of others.
Has there been any difficulty or challenge in getting the tests?
We have not had difficulty getting tests. No, we have had all that we need.
As you know, Lynchburg City Schools has canceled school for a couple of weeks, and some colleges are debating whether or not their students should come back after spring break. And in your professional opinion, is Lynchburg City Schools on the right track? For Liberty University, who says our students will be out just for spring break and come back, are they on the right track in your professional opinion?
Yeah, sure. This it's not, so I'm a physician, and we can talk about certainly risk factors from a medical standpoint, and certainly, again, we know being in a room by yourself is less risk than being in a room with one other person, and then exponentially beyond that point. Again, I think in general, the less crowding we can have, the better. And I recognize these are very tough decisions and require a lot of thought and again, so I'm not going to either reinforce or really go against any decisions that are being made. I know everyone's trying to get the latest information, and things are also changing rapidly. And so every day we're getting more information about how safe it is to have a group of used to be 100 people, now people think it's, wow, can we get down to 40? And ultimately, I think even how can we eliminate groups of people that are congregating together all together and communicate by telephone or video conference.
Jump in here too. And just to kind of further discuss this, the reality is the way the virus spreads is person to person, we believe through respiratory droplets. A virus is mostly genetic material, and that poses tremendous problems for us because we have genetic material as well. So if we target something chemically that destroys genetic material, then we run the risk of it making us sick too. And that's why it's so hard to create antiviral medications that effectively treat viruses effectively, because we kill the virus, then we run the risk of killing ourselves. Bacteria, on the other hand, are much more complicated. They have many more moving parts. And so we can develop antibiotics to kill bacterial infections where viruses are really difficult. And so because viruses can't really be treated effectively, at least not this one yet, the only way to stop it is by avoiding person-to-person spread. If the virus infects somebody, that person then starts to destroy it and it doesn't have the opportunity to go to someone else, then the virus will die. And that's ultimately what we're trying to do by flattening the curve and trying to prevent the spread of the virus. So there are measures we know that are effective in doing that. One of them is, just washing your hands, as Dr. Thompson alluded to earlier. The others are ensuring that we're doing social distancing, not standing too close to each other. And in addition to that, making sure that we're not congregating together in large crowds. I think a good example of that was the conference that was held in Massachusetts, in which effectively 72 of the 90 initial cases reported in that state were all participants in one conference. So aggregating people together is a way to make the virus spread. And so I think we all have to use good judgment and discretion around doing that. So while we can't require our caregivers, for example, to not congregate after hours, we've asked them to use good judgment around that because we need to protect them and we need them to also protect our patients from developing an infection. So all of those things are things we can do to try to effectively prevent the transmission of the disease.
Dr. Muller, given what you just described and how this spreads, do you worry though, having, I'm going to call out Liberty here, 15,000 students, residential students leaving our community and then coming back next week, do you worry that that could create a community spread situation that could ultimately impact your hospital? I mean, I know you don't want to comment on what they're doing and their decisions, but does that concern you at all as the CEO of Centra that that could impact your hospital system, your medical system in any way?
I think I don't know if there's enough information to really make an honest assessment of that. I don't have, as we stand here, all the information about some of the measures that they're putting in place to try to reduce the transmission of the disease. But I think we all stand to have the best outcome if we're doing those measures that we discussed earlier, practicing good hand hygiene, using social distancing and avoiding large congregations.
A lot of people have been self-quarantining this past weekend and week, avoiding large gatherings, but some people are actively ignoring that, going out to bars and clubs, some downplaying COVID-19, comparing it to H1N1. Can you speak to the severity of this kind of in layman's direct terms?
Yeah, absolutely. This is a fairly contagious virus. It's not the most contagious virus that we've had to deal with in the past. The measles, for example, is far more contagious than this particular coronavirus and the disease COVID-19. At the same time, too, it is fairly easily transmittable. And the challenge with it is it carries a mortality rate, a likelihood of killing you that is probably somewhere between 7 times greater than the flu. And the flu is a pretty lethal disease. And so we've all heard about the large statistics, the large number of people that die every year with the flu. And you have to recognize that we still end up with, in some cases, 50,000 fatalities tied to the flu in an environment in which we vaccinated about a third of the population against the flu. We don't have a vaccine yet for this disease, which is why there's such risk. And so while we don't necessarily know what the true mortality rate is going to be, some speculate it's a little bit lower because asymptomatic and lightly symptomatic patients aren't getting tested. So we're aware of those patients in the denominator. There's also the reality that we may have had some patients die in American hospitals or other hospitals that had pneumonia, and we didn't recognize this was COVID-19 and never got those patients tested either. So it's unclear what the final mortality rate is, but it is substantially higher than the flu. This can be a dangerous disease for an individual. And even if you're in a population that is not at risk for having a bad outcome with the disease, younger adults, for example, you're still at risk for transmitting the disease and ultimately allowing the virus to find its way to an elderly patient or a patient who has other medical conditions that puts them at high risk for a really bad outcome.
I have a question for Dr. Thompson. You talked about people who have been coming to the testing centers. This is something you all just said this past weekend, right, or last week. So would you say you all had a busy weekend of people coming in wanting to get tested and may see symptoms and think that they may have COVID-19?
Yeah, it's interesting. So we started it late last week. I believe it was Thursday. Days are going by quickly now, but it was late last week that it was set up. The first day was very busy. To be frank, over the weekend it was a little less busy. When we initially set it up, we didn't want to overwhelm it, and we really, it was really for physician referral. So it was really to serve the medical community and all the patients that were going to their own physician, and to congregate really the knowledge about having testing kits, having the appropriate personal protective equipment, having the knowledge about exactly how to collect and send the test. We wanted to really perfect that in a small number of sites so that we were able to just make sure we were getting it right. And so that was how it was rolled out last week. We then said, hey, this is going well. It's not being overwhelmed. Let's go ahead and open this up to all communities, and people can come straight to the sites. And again, if they met the appropriate criteria, then they could be tested. So it's busy, but they're not being overwhelmed. The people there are doing a great job. They've really done a fantastic job of setting up the process. You're going to see people that look like they're in spacesuits to come out to collect specimens, but the process has been really well orchestrated.
So for people who come in to get tested, when they've been out in the community before they had symptoms, is it possible that they infected someone in the community before they had symptoms?
It is, and one of the key things about this virus is that we are learning about it. So there's a bit of uncertainty still about certain characteristics, and the things that that are still uncertain. You've heard people ask the question: Can your dog get this? What's the infectivity of that? What's the infectivity of a fetus? How long does it live on a doorknob? And you can still get it. One of those is the exact details of your infectivity. After an exposure for those, let's say they were to get it, at what point are they able to have it be communicable to someone else? We don't exactly know. We're finding these things out ultimately around the world as we're getting more information. But it is possible for someone before showing symptoms to be communicable to someone else, as with really any other virus, and as with the coronavirus that we dealt with before this season, which was the common cold. So you could and that's part of the difficulty is when you're sick, hey, I need to isolate myself. But if you have an exposure but don't have symptoms, it may not be as clear that you need to do so.
And then for these testing sites, what exactly does it look like when someone, say just the average person wants to go get a test, so they pull up these testing sites, they'll be asked the questions, do you have these symptoms? If they do have the symptoms, what does the test look like? And if they don't, do they just get turned away?
No. Yeah, good question. We're trying to do as much as possible remotely. And by that I mean telephonically. So if a patient, for instance, in the first days of the testing centers, if a physician referred a patient there, registration would take place over the phone. So they would be asked to call a number, and registration could be taken over the phone so that there was no direct contact. Our initial process was that the staff would certainly put on the appropriate personal protective equipment, go out and get patient information through a baggie, and really try to keep from touching. And ultimately, once a patient was registered, we made sure we knew who they were so we could follow up on tests and ultimately report the appropriate testing and know who the patient was. Then it really is a nasopharyngeal, so it's a swab that's up the nose, like any typical flu test. And it may or may not also be a swab in the mouth, almost like a strep throat test. And so increasingly, we're going to be using both of those. So you might get a nose test and a mouth test as well. And that really is the testing.
Before we started here today, Idris Elba, an actor, came out and said that he tested positive for COVID-19. He knew he was with someone that tested positive, and then he went and got tested, but he had not seen any symptoms yet. So what would you say to people who may be questioning, or who may have not seen symptoms yet, but want to be tested to be sure they do or do not have it?
Sure. What you just described brings up a couple really important points. And that is, there may be individuals out there who have this virus who never show symptom number one. And they may go through a period of time where they could be communicable to others, but may never show symptoms. They may never get cough. They may never have fever. They may never have any of these things. So that's possible. And clearly we don't know what that number of individuals yet, but we think it's probably pretty large. Secondly, if someone, there are a couple choices. If someone has a contact of someone that they know has had a positive test, one of a couple things should happen, and particularly within the past couple days, and that is they should either quarantine themselves or go ahead and get tested. The challenge may be if someone gets tested on day 2 after being exposed to somebody that has the illness, we don't know yet whether that test would be positive or not in someone who ultimately may contract and convert to a positive test. So that is, as we stated, the test itself is not really the determining factor in exactly how someone is treated or whether someone is quarantined or watched and isolated from others. It really is the story. It's the story of contacts. It's the story of travel that may ultimately dictate that treatment. There are plenty of individuals out there that are simply being watched for 14 days in isolation that will never get a test. And if they're asymptomatic in 14 days, we feel very comfortable that they will not contract the virus or be infective to anyone else.
Has there been any kind of failure on the government's part to respond to this quickly enough that's putting a bigger strain on the medical industry? And if so, is there anything that can make up for that going forward?
Yeah, it's hard to say. I think we probably have learned a lesson around the importance of surveillance testing in creating a public health system that allows us to test rapidly early in the progression of a pandemic. I don't know enough to understand whether mistakes were made or not, but I think we've probably learned a lesson around the importance of making sure that we have an adequate testing program in the future if something like this were to arise. In addition to that, I think there's just a lot that we're learning in general. And I think we've got good opportunities to continue to practice good, safe social distancing techniques to ensure that we're doing our part not to spread this condition. I frequently use the analogy, we're at war with this virus. We really are. And we don't have bullets and we don't have antibiotics, but what we do have is our ability to prevent the virus from spreading from one person to the other by maintaining adequate distancing, washing our hands, and trying to be smart about how we conduct ourselves on a regular basis.
Dr. Muller, you mentioned that we are at war.
Mm-hmm.
And Liberty University has students, thousands, coming back. If something happens, Centra will have to help these young people. So you said you don't know what they are doing. Should you know? Have you reached out to Jerry Jr.?
We've certainly had conversations with officials at Liberty University to try to make sure that we're being communicative and trying to understand what we can all do to play that role in that war against the virus. I would say that the reality is that college students in general are in the lowest risk category for disease. So I think the reality is that we wouldn't necessarily see an onslaught of patients, particularly patients needing hospital care, from that age group. There is a reality, though, that the young adults may be in the highest risk group in terms of transmitting the disease. And so, of course, the fear, I think, is less that we'll have an onslaught of college students, but rather we'll have the transmission of the virus to those who are at risk, those who are elderly in the community, or those who have underlying health conditions. And then we may ultimately end up having to provide hospital care for those patients.
Have you emphasized that in your conversations with the school's leadership, and can you comment at all on what their response was?
Yeah, and I don't want to get into specific details about conversations. A number of us have had conversations with the organization, and so I don't want to mischaracterize any of those.
Say someone does test positive for coronavirus, are you then going to ask them to give you a list of maybe all the people they've come in contact with and track their people and ask them to get tested?
Yeah, that's what we've been partnering with the local health department for. They're the ones who really are the epidemiologists who help try to track down who's been exposed and then what we can do to try to mitigate the spread of the
So you are
disease.
tracking
The health department is.
The health department is, okay, but you are helping them?
Absolutely,
Okay.
absolutely facilitating those conversations.
Dr. Moore, this is my last one.
Sure.
There are still a number of people
Uh-huh.
who say, we the media are making a big deal out of this. And we are overblowing it. For those who have that view, what do you say?
Now, that's a big deal. The fatality rate of this disease is substantial and significant. And the vast majority of the patients who are going to be impacted are older. But as we're beginning to see, based on the experience in Europe, the experience in Korea, and now the experience in the United States, unfortunately, there are also going to be younger adults who have bad outcomes as a result of this disease. It's a scary disease because we can't really accurately predict who is going to have a bad outcome and who is not. This is a real threat to all of us. And so all of us, if we play an important role in trying to mitigate the spread of the disease by some of the things we've mentioned earlier, can really make a big impact.
At this moment, actually, President Trump is giving a briefing. And he said that the coronavirus reality could last until August. Are we prepared for a 6-month pandemic?
I can't speak to the nation, but I can speak to Centra and say yes. I mean, we are considering the fact that we may be in this condition and are having to make these types of changes for many months on end. There are a whole bunch of different models that explain how the virus could potentially look. One is that we'll see a little bit of a cessation in the summertime, as we see with the flu, but then we also have to recognize that if that's the case, just like the flu, we're probably going to see it come back in the fall and winter and create a similar circumstance again. There are other predictions that this will continue just to stay at its current level or continue to grow for many, many months before we're able to start to get this to a better level. So we're taking the stance that we have to be prepared for either scenario, and you're trying to make preparations across the entire spectrum of the organization to ensure that we're going to be ready to care for the patients of this community.
My last question would just be, how do you help the public not panic? We're here today doing all of this and talking about steps to take. It's kind of hard not to panic, so how do you reassure people not to?
So the reality is, for most of us, the virus presents a small threat. And so the reality is that a lot of what we're asking people to do is not only to protect themselves, but to protect others. And so keep that in mind as you're thinking about this, is that for the average person, the risk of contracting this and ultimately having a bad outcome is very small. But it's real. And so you don't need to panic. At the same time, you shouldn't ignore. You should be prudent and thoughtful and smart, and think about how you conduct yourself, how you wash your hands, how you distance yourself from others, how you spend time after hours and around others. And all of those things, if you do those things, then the likelihood of you ultimately contracting the virus again continues to remain low. Thank you all for being here. Appreciate it. You bet.